Good evening, and welcome to our second webcast sponsored by Hope Abounds called Focusing on You. My name is Lisa Cawthorne, and I will be your host for these live webcasts offered on the second and fourth Tuesdays of each month. Next week, actually, you'll be able to see this as it was recorded on the 4th of July if you missed it being live. I am a volunteer with Hope Abounds. I'm also an oncology nurse and a breast cancer survivor myself. Hope Abounds provides assistance to teens, children, and women who have a cancer diagnosis and their families. We provide assistance through financial assistance, advocacy, and educational programs such as this program tonight. If you watched last week, we featured a survivor named Kelly Barnes-Smith who told her story of her breast cancer journey and the diagnosis of congestive heart failure that happened to her as a survivor. I just wanted to give you a few statistics about breast cancer. According to the American Cancer Society, there are 3.1 million breast cancer survivors, either in treatment or have completed treatment. Early detection has led to better survivor rates, but unfortunately, breast cancer is still the number 2 cause of cancer deaths, with the number 1 spot going to lung cancer. For all stages of breast cancer combined, the overall survival rate is 90% at 5 years. So it's good, but we got to get better. So today we have another survivor with a remarkable story. These stories are not meant to scare anyone, but we do want to offer up awareness and encourage you to be an advocate for yourselves and to inspire hope. Kim Smith is a breast cancer survivor and a 2-time heart transplant recipient. Her husband, Dr. Ben Smith, is also here with us tonight to provide some perspectives on what it was like being a caregiver as she went through this. So welcome to both of you.
Thank you.
Thank you.
So Kim, let's sort of start at the beginning. If you'll tell us a little bit about your breast cancer diagnosis and when and what happened, what kind of treatment you received.
Okay, well, it was 3 years after my mom died from breast cancer that I found my first lump. It was in the right breast. It was infiltrated ductal. The margins were clean and the lymph nodes were clean, so they chose at that point to do a partial mastectomy because I was 31. Mm-hmm. Hadn't had any children, wasn't married, and I was actually in nursing school. So we did 6 chemotherapy treatments there in Frederick, Maryland, of adriamycin, 5-FU, and Cytoxin, followed by 38 radiation treatments at Greater Baltimore Hospital. And I was young, thought that was behind me.
That was a lot of treatment, right?
Yes.
For something that they said no lymph nodes, but...
Oh, the lump was small as a peanut. And, of course, that was in 1993.
Okay. So then what happened after that?
Nothing for 10 years.
10 years?
10 years. Went on to have children, which they said I would not be able to have children with that kind of chemotherapy cocktail. They told me that I would be in early menopause, which was true. I went into early menopause, but made out of different stuff, and my body reverted back after a year being completely in menopause. And so I have 3 boys.
Wow. How old are your boys?
22, 15, and 14.
Wow. So that was sort of another miracle that happened for you.
Miracle too, yeah.
So then after that, you said you were in remission for 10 years?
Well, I did.
Or then tell us what happened after that because you had a recurrence of breast cancer, is that right?
I did, but I had the heart failure first.
Oh.
After the 3rd baby, our last 2 babies were born after we turned 40, and they were born 11 months apart. So none of us knew that my heart had already gone into some struggle.
Oh, wow.
Who knew? So we go through the pregnancies, and I had very big boys, and I had all of my deliveries were natural, so I had to be an athlete to get through them. And it was when the third one was 3 months old, I started having pain between my shoulder blades, felt like I had the flu. I didn't feel good, and I was tired, and I gave it all, that it had to be. I had one in pull-ups and one in diapers, one with a sippy cup and one breastfeeding still. And I did breastfeed my babies, even though a partial mastectomy on one side. But I just equated all that tiredness and pain between my blades from toting big, as you say, really big babies around, that I'm just tired. I'm an older mother. I'm, just
Right.
any kind of excuse.
So then when did you end up going to the doctor because it didn't get better, or did it get worse?
I
what
couldn't
happened
breathe
then?
by that night. Finally, by 1 o'clock, I went and woke him up and said, I cannot breathe. And we started chasing it, but they chased pulmonary. Nobody caught on the x-ray that the heart had swollen out and that I had ascites going on, because I had just so shortly been so pregnant, 3 months, that it was so masked. You just didn't see that it was fluid, not, post-baby.
Right.
And, I present well, even when I'm very sick. I still present well, like I'm not sick. And I'm telling them I'm sick, but they don't look at me and think I'm sick, which happened at Duke. But, so it took emergency room, and then follow up with the doctor, and follow up with emergency room, and final emergency room. So a week later, I'd been in congestive heart failure for a week. By the time
They finally diagnosed what it was.
Dr. Christopher Barber, the cardiologist, happened to be at the ER called into the ER that night, and he pegged it. But up until then, a cardiologist had not been. They just kept thinking it was other stuff.
Well, again, a lot of people associate congestive heart failure with the elderly.
Oh,
And in
yeah.
your case, definitely not
41.
elderly. Yeah,
41
years old. So what happened after that, after your diagnosis of congestive heart failure, which means the muscle isn't contracting as well?
Right.
So
The
that
left-
causes a lot of the tiredness and the shortness of breath and things like
Yeah.
that. So what did they do for your treatment for that?
Well, I've always been kind of unfortunately an unusual case all the time. Every time, all the time. So I go in, and he can tell you, because by this point I was out. I couldn't open my eyes anymore, and I was in the ER. So he's not talking unless you ask him a question.
That's okay.
But it was that the left ventricle was gone. It had thinned out too much. But
So
the
your
whole,
memory of that was really, you were so sick, you don't know what they were doing at
by that
point.
point,
Is that right?
I just remember I began to disassociate. We found out I had been in organ failure for 2 days by the time that they
Wow.
finally put it all together, and told him, look, we just feel like we're going to just keep her here overnight, because we don't really think she'll make the transport to Raleigh. We're doing all that can be done.
Right.
We can't even get but one number for a blood pressure. We're not registering much. And they got an O2, and my stats were terrible. So they just pushed some morphine and put me in CCU and told him to tell me goodbye.
Well, Ben, this is probably quite a shock to have your wife with 2 young kids at home, and all of a sudden they're telling you that this might be the end. I mean, what were your memories at the time of what happened?
Well, it's a little bit of a blur, but it was a bit of a shock, because, like Kim said, that week we thought it was just pneumonia, and then unfortunately it just got, she just didn't fit the protocol for congestive heart failure. So, but yeah, so that was like on Sunday night when we first went to the emergency room, and then throughout the week. And then I think we even went, I think by Wednesday we'd been to the hospital and they pulled fluid, stuck her in the back, pulled fluid off of her. She got better for about 12 hours and then
Till it reaccumulated.
and then it just went downhill. And so she laid around all day Thursday, and then Friday she was just looking really rough. And friends were coming over, and a couple of her close friends came over, and
It was
that
Saturday
afternoon.
when you took me. Saturday.
Anyway, they said, and she just looks awful. Y'all got to go back to the emergency room. So we went back there, and it was all I could do to get her there. And she was just kind of becoming incoherent, very lethargic. Just
not enough oxygen, not enough blood
so-
going through your body.
Yeah,
Right.
but that was quite a shock when the doctor walked. We got her settled down and got her in ICU. Once we got through the process and got her in ICU, and he did come out and he says, "I don't really think she's going to make it through the night." And I was just like, "You gotta be
gosh.
kidding me!" But so just had to.
Did they put her on the transplant list then, or did they?
No, they were just trying to.
didn't
They were
think I
just
was gonna
trying
make
to keep you alive.
Yeah, he did.
They-
Give you lots of medicines and
Yeah, he's-
oxygen and
Yeah, just seeing what he could
Sort
do.
of
But it was kind of a
monitor
last
you.
ditch effort, is what I understood it to be. He said,
wow.
so.
So you made it through the night
Mm-hmm.
in the ICU,
I did.
and then what happened after that?
Well, I do have to say this, though. Because I can remember him trying to get me out of the vehicle into the emergency room. And I can remember everybody's voice says getting very distant and feeling that peace. And I mean, people talk about what death might feel like, or just you're not fighting it any longer. Mm-hmm. I had been fighting to breathe for a couple of days that I was
Right.
tired.
Right.
But when I opened my eyes in CCU, and I was the only one in the little room, the last thing I remember was the bright lights of the ER. And now I was in the dimly lit, CCU, and could look around. But I woke up bright and awake and alert. And, needing to go to the bathroom. And hadn't been able to do that in a couple of days. And having a spiritual experience that I never had, ever. And it wasn't a euphoria. A lot of the medicines still weren't moving because I was so dehydrated, there wasn't anything to move them in. Mm-hmm. And he will tell you, Dr. Barber said, this was the first real miracle he'd ever seen in his he'd said, I've been doing this 18 years at that point, right? And he said, I kind of wondered why I was a cardiologist until you showed up. Mm-hmm. And he said, I used to look for your name. When it was on the schedule, I was excited to see you. He even gave testimony at my church that it wasn't textbook possible for things to unfold and go the way they went. That I had a knowing that my faith was always strong, always. I always had hope. I never ever saw the glass half full. When people would ask me, how do you see the glass? And I always saw it filling up. I never saw it half empty. I always saw it filling up. That's what it looked like to me. It wasn't draining down. I never understood half empty or half full. It's always filling up. So I knew it was going to be okay.
So it's a feeling of calmness and
Yeah,
maybe
confidence.
trust and
Pure
confidence and
pure confidence.
optimism.
I didn't even need that. I didn't even need optimism. I just needed to go home. I had babies to feed. And so when they came, I told them, I'm going to be okay. I've already been told I'm going to be okay.
Wow.
So that faith, if people, it's like faith is believing without seeing or being able to prove why you believe it. That's what faith is. And I had that. So when the doctor came in and he was like, oh,
You're still here.
yeah, basically. And so they moved me to the heart floor. And in 3 days, I had begged. They snuck the children in to see me. I had babies in both arms. I was so happy. Remember that? Y'all came up through the...
The back elevator.
You can't do that anymore, but back then you could. And 3 days after I was put in the hospital, I was discharged. he didn't want to discharge me that soon because he was like, this isn't possible, but you being here isn't possible. And, I was checking, my heart was still out there. I had only 17% function when I got there. And he said that was generous. And I think, after 6 or 8 months, I may have had 20%, then it went to 35% and hung out there for a while. And then
It's really good you had some improvement. So obviously the
yeah,
medications did help
well, yeah,
somewhat.
I got
And
put on Coreg, and but that was something he said was odd, is that that it continued to swage down, and that's why they didn't know how to diagnose that congestive heart failure at that time. I was 3 months postpartum, so they thought could have been a viral. Pericardial virus with around the sac of the heart. Then they thought, okay, it must be postpartum cardiomyopathy. And that was a diagnosis that actually went in until a little while later, and it had to be changed that it was cardiotoxic drug that had damaged the heart. But the treatment was the same.
Right.
It was Coreg. For me, it was Coreg. I know other people probably have different beta blockers and things, but that one and I got along with well at a very low dose. Even with all that damage, 4 years into this, I weaned off Coreg because I was a competitive horseback rider. And Coreg wouldn't let my heart beat any faster than 72 or less, and I was going to fall off, pass out, and get trampled. So I was, and I made it 4 years competing. My heart output wasn't as great as everybody else's, but I still was
you're able to function and do
better than function.
Yeah. Do things you really wanted to do.
Absolutely.
So then you weaned yourself off the Coreg. Your heart's doing a little better. Now what?
4 years later. Well, we forgot, though, that after the first heart failure, that was February 15th of 2003. October, that same year, is when the second breast cancer showed up.
Okay.
And so it wasn't a reoccurrence, it was just a new breast cancer. It was
Same
still
breast or other breast?
opposite breast.
Opposite breast.
But it was still this infiltrated ductal.
Right.
Nothing in the margins, nothing in the lymph. Treated with the methotrexate and 5-FU and Cytoxin, and a double mastectomy with follow-up of some reconstruction because I'd had the radiation. They were a little bit
more
leery,
challenging.
but they still, Dr. K's stepped up to the plate with his, had to twist his arm a little bit. I said, don't worry about that radiation area, it'll be fine. And it was. So until 4 years after I'd weaned off Coreg. I got a run of 4 years. And then I went into left and right ventricular block.
Wow.
And I was in right congestive heart failure for a year.
So the timeline, breast cancer the first time.
10 years.
10 years later.
Heart failure.
Heart failure. Then a
With
few
it.
months after that, diagnosed with another breast cancer.
And then 10
Treated
years.
for that.
10
And-
years later was the final failure.
And then the final failure. Wasn't the final. Well, I guess it was.
For that heart.
Since you had a heart transplant, I guess it was the final failure.
Yeah.
So,
Yeah.
what happened with that situation then?
Well, when I went into that failure, that's when my sweet cardiologist here, Dr. Christopher Barber, was like, look, I've been the plumber. You need more than me now. And
Okay.
we really, I had milked it so hard for so long that really a biventricular wasn't going to help it because it was the muscle, the left ventricle was so atrophied. It barely was, and the right was in such distress that just trying to get something.
So your
to
ejection
push-
fraction probably went down again.
Oh yeah.
Right.
Yeah, and it was on a slow, steady decline.
Okay.
And
How are you feeling? I mean, did you know what was happening, or were they monitoring you?
Well,
How did
yeah,
that-
we were beginning to try to step it up, really, because, he said, you really need a transplant. Well, being a breast cancer survivor twice, and at that time I was 54, I was like, who's going to give me a transplant with that type of history? Honestly, I thought, shoot, I mean, I'd be such a high risk for some other,
And what was the doctor's response to that?
He said, well, we need to follow up.
Okay.
We need to follow up. So we got a name. At that time, it was a Dr. Rogers, who had just come from Boston to Duke. And he was, I think he was head of cardiology and transplant at that time. He was. And I met him.
Mm-hmm.
But there again, I had a little zip, had a little movement. I felt good.
You looked good?
I presented too well. Well, I was blue, but I had on makeup. And he did tell me after my second transplant, I got to see him in the cafeteria at actually my 1 year.
But we're getting ahead of
myself.
ourselves.
Yeah. So I saw him. He sent me home. That was in
Yes.
May. And he said, we'll see you in July. And I was like, okay.
So you weren't on the transplant list at that time, or you were?
No.
Because you have to go on a list, right?
Yeah. And that was my first time of really knowing inside, I may not make it to July. I wasn't that I didn't have hope or faith, but I knew. I knew I was, and this was before I'd had my gallbladder. I had to have an emergency gallbladder removal in June, which I was supposed to go see him in July.
So
And
you
I-
really didn't have enough going on, so you had to throw in one more
Yeah,
thing.
I had to have one more thing.
With small boys at home, I still...
Yeah, and
They're getting
moved.
bigger now,
We're-
but-
Yeah.
We were moving from our house at off Airlie to go to the country, and so during trying to pack and move,
So gallbladder in June. And when was the move?
during that, we got into the house, and I told him, because during the packing I was lagging farther and further behind, and I
More
told
and
him,
more
I said,
fatigued.
I can't keep up. I can't keep
Yeah.
up. Well, I kept telling him I was hurting here. So every time I saw my cardiologist or I saw anybody that, I'd tell them I'm hurting here on exertion. Oh, well, you're in right-sided heart failure. This doesn't feel like any of the other heart stuff.
Okay.
This doesn't feel like any of the other heart stuff. And so, anyway, long story short of it, I had to actually make my own referral for myself and go see Dr. Bebb, who had done the double mastectomy 10 years earlier. Mm-hmm. I got myself through the door saying, I'm here for a follow-up. They didn't ask me what year. I didn't give the information. I got through the doors. He goes, and what am I seeing you here today? What am I following up? So I told him who I was and told him why I was there. And he said, you have a pulled muscle. And I said, I've ridden with broken ribs, cracked fingers, everything else. I know the difference. This is not a pulled muscle. I begged him. I said, I'll pay out of pocket if I must, but I got to rule out that there's something in here right here. Mm-hmm. Well, they did a sonogram, and he come rushing in and said, we're going to see you in the morning at 4 o'clock across the street. You're going to be our first patient for surgery. Right now they're expecting you at the medical mall. And my gallbladder was full of stones and infection.
Oh.
So that was what was causing this.
The pain in the center of your chest.
Right at the pyloric, right under the xiphoid. I mean, it was bad if I got to moving too fast. But it was while I was asleep on the table with them doing just the laparoscopic, the little heart didn't handle being asleep very well.
I was about to say, because you were higher risk related to the heart issues
Dr.
that you
Barber
had.
wasn't really happy about it, but
But he knew he had to
said he
do
wrote
something.
a book for the
Surgeon
well,
that
for
did the laparoscopy.
the anesthesiologist.
Yes.
That was who he was worried about. And sure enough, they ended up shooting it with epinephrine, and that was, the little heart couldn't handle that. I mean, I pulled through it, but I had to stay 3 days in the hospital. I came home, and it was just, that was it. It was just, I was clipping every day. I was dropping further and further. I got to where I was spread eagle on the couch, both arms up to
Right.
breathe.
Sleeping on pillows.
Ability to hold my head up. The kids were.
So a lot more fatigue, shortness of breath. Did you have any of that?
Oh, it was, yeah. That was,
Did you have any pain at all, or was that all related to gallbladder?
It was more, I was suffocating. I felt like I was suffocating all the time.
It's an interesting description. So then what happened then? Did you go back to see your
Well,
cardiac?
our appointment, our
doctors?
follow-up July appointment was now approaching.
Right.
And I got to let him tell this part because I've done all the talking, and this is his best part.
All right. Ben, I think you're on.
Well, it's neat how, in a way, how it unfolded. You know, as Kim was in distress, and there was, like I said, Dr. Rogers, super nice guy, and Kim has always just been a tough cookie. You know, so she presented well. So I don't think he realized how bad a
severe
shape
it
she
was.
was. And
Yeah, he
you know,
did.
and as we've gone through this process, getting on the transplant
awesome.
list is not just walking in the door
Yeah.
and get your name put down.
Nope.
It's a process that.
You have to have all the documentation.
Exactly, and for insurance to cover. So it's a process. You can't just walk in there. So anyway, long story short, a good friend of mine who's a dentist in Raleigh had a patient that had some significant heart issues, and he had just gone on about this doctor that he had at Duke, a Dr. Milano, and he suggested that we might contact him because, you know, he had heard our story. Kim was not doing good, and he just went on how well Dr. Milano had done. And so he, in fact, even gave me the number. And it's, you know, because Kim was just steadily getting worse, and we didn't seem to be getting anywhere. You know, it was just like I said, the process. You have to go through certain things. Anyway, so I called his secretary, and because Kim, like I said, Kim's looking bad, I called his secretary and left a message and figured, okay, you know, they'll get back with me in a couple weeks.
Right.
You know, and I was, you know, meanwhile, Kim's just getting worse every day. But as a matter of fact, I called that morning, and had actually gone out to the hunting camp to check on a deer stand, and she called me, and I got her on my cell phone in the woods in the middle of the swamp out in Bladen County.
Another
which was
good sign.
Another miracle. I was like, you know, I'll never get
That's
phone
right. You don't
calls
get
out
cell
there.
coverage.
And she said, well, asked me what was going on. And I told her, and since Kim had been in the system, she pulled her records and said, all right, I'm going to send these to Dr. Milano. I'm going to send all this information to Dr. Milano for him to look at. And I thought, wow, that's pretty incredible. You know, I thought we'd have to get an appointment, you know, which would be another 2 weeks or something like that. So anyway, and so I came home and told Kim that. And I think this was like on maybe this might have been a Saturday. And so anyway, Sunday morning, me and the boys go to church. Kim just wasn't able at this time to do hardly anything. We left her at home, and he called me while I was in church, and I almost didn't take the call, but I got up and walked out.
Another good sign.
Yes. So, and so Dr. Milano talks to me, and he said, "What's going on?" And I said, "You know, my wife is really doing bad. You know, she's blue, she's in distress, she can't do anything." And he said, "Well, can you get here tonight?"
On a Sunday.
And he was there on Sunday. I actually had an appointment that following Thursday.
on a Sunday.
And he told him, said, she'll never make it to the appointment
Yeah.
on Thursday.
Oh,
He said,
wow.
I've taken the liberty to admit
So
her
he
already.
said, "Can you get here Sunday?" He said, "Just go right in the hospital, and I think he said go to some floor, and they'll tell you what room to go in." So that's just virtually unheard of to just walk into Duke Hospital.
You were just
and go into
admitted
a room.
on
Yeah,
Sunday
usually
night.
you've got to go-
Direct admission.
Yeah,
You got a
as you go to
direct
emergency-
admission.
You go to emergency room, you're going to be there for hours and hours before you're going to get somewhere. We walked in there like it was the red carpet, and so they immediately got her in there, got her hooked up, and got her some fluids, got her some medicine to strengthen the heart. And so-
Monitored you, so they knew what was going on.
Yeah.
It wasn't you just saying,
Right.
I feel
Yeah.
bad. Now they had all the other
Right.
proof.
Now they don't know. I mean, the clock now is too short. And I went into cardiac shock the next morning at 9:15. So they had to put a balloon through the groin, floated up into the aorta to sweep the blood out of the heart.
Yeah, to help.
Just to
Wow.
strengthen the heart.
well,
Wow.
it wasn't to strengthen the heart. It was just
But
to get blood around to
yeah.
me because everything was going
help
into
the
failure.
circulation, to help the heart.
And to try to preserve me,
Yeah.
I had to go through all the tests still. I still had to pass all the FBI tests.
to get on the transplant
to
list.
get on the transplant list.
Screen for cancer, colonoscopy.
Every kind of screening.
Incredible amount of testing that had to be done.
And I was on a heart pump, grasping.
Wow.
But I
So that's when you went on the transplant list the first time. How long
Exactly.
did that process take to get on the transplant list?
was
I'm just
quick.
Well,
curious.
it was a week. It took almost a week.
A week.
But what they do is, well, it was about 8 days, 8 or 9 days. But they start you from the time they start the testing. You're not actually on the active search list. Mm-hmm. You go on, your name gets on the slot because everybody has to spend whatever. They have all these rules and regs on for the state of North Carolina. All the transplant centers, all the people who are in need of transplants, they go by your age, your need, the desire, not the desire, but how bad your body desires it, how bad you've got to have a transplant.
What category
so
you're
that
in.
there's no
acute
favoritism.
it
Nobody
is.
can
Right.
pay somebody under the table. It is very, very meticulously handled. You are going to be only a case number so that nobody can get
Right.
involved with
No
knowing
favoritism,
where this
no.
heart comes from and what patient's going to get it. So I'm O negative, which makes it even harder to find a match.
So 8 days, you were on the transplant list. How long were you on the transplant list? And what was your
The first time.
condition the first time
Yeah.
before all of that happened?
Well, I was not doing that great on the pump. I was stable, but I wasn't.
But you were you in CCU at the time, the cardiac care unit? Or
I
were
was
you,
in the ICU. I think
Yeah.
I stayed in the ICU. Seems like until a few
You were in
times.
the cardiac care unit, CCU. Yeah.
Cardiac
Not
care.
ICU, CCU.
Okay,
first.
CCU at that
Yeah.
time.
Yeah.
And then,
unable to go home.
oh,
Yeah,
I
oh, yeah.
couldn't. I was
So you were
on-
in the hospital.
on my
You were
back.
so critically
Could
ill,
not
you had
lift
to
my
stay in the
head.
hospital.
Yeah, I laid on my back 28 days, which really O negative. They said it could be 4 months to 8 months.
So it was 28 days
For the
before you
first
got
heart.
your first heart. And you got the transplant. And then, sort of, not everyone may be familiar with what it's like to get a transplant. So you go to surgery. What did they tell you when she went to surgery? Did they lay out possibilities for you, or did they tell you what it would be like when she got out of surgery? What did they say, Ben?
A little bit. Of course, it's kind of hard to take it all in. I'm trying to wrap my head around
A little bit of a
transplant
blur.
in itself because it came down quick. Because it was. I got the call. I'm driving out of the driveway, take my kids to school the first day of school, and we get the call on the phone. We got a match. You got to be here by 11 o'clock. So I'm hit with, oh my gosh, I got 3
It
kids
does
in school.
happen
What am I going to do with kids? What am I
Right.
going to do with my business? So, and I got to be in Durham in 4 hours or 3 hours because, this is all going down. So, so you get there and it's a rush to, get her prepared for surgery. So they're kind of going through what's going on, what to expect. It's going to be a long surgery, and,
We had
she'll
a lot
probably,
of delays,
then
though.
she was
We
going to be,
didn't get
pretty
in.
much out of it for a few days. You're not going to be able to talk to her. We're going to keep her sedated, coma, in an induced coma.
Right.
So,
So you were at home. She's in CCU. You're at home with 3 boys,
Yeah.
working full time.
yeah. And driving up on the weekends, we drive up and see her, bring the boys up.
Right. So you had many challenges yourself.
had to keep
Keep
Yeah.
the home fires
had to
burning.
keep things going. Yeah.
Right.
It was unfortunate because Kim was, still 2 hours away. It could have been worse, but it was still difficult. And
It's a hike.
It's a hike.
And they just moved there.
Yeah.
So nothing was in its place. The
Lots of
only thing I
boxes.
managed to
Yeah.
get in its place was I got them enrolled in school, got their school clothes bought, got their lunch boxes. I had the main items in their drawers and their desk, but everything else. There was only one small box of dishes unpacked. Everything else was packed.
A little chaotic.
Very
A little
chaotic.
chaotic. Paper plates and a lot of takeout, right?
Yeah, that's right. Yeah.
So you got the transplant, and then how long were you in the hospital after that? And what happened to that? You keep saying the first heart. So what happened to that? Well, it's actually your own heart failed. Then you got your first heart transplant. So what happened after that?
Well, unfortunately, when she went in for the transplant, the surgery was supposed to go down at about noon. It didn't go down till almost midnight. Backed up. Emergency, just got backed up. There was just too many things going on, so we didn't get the heart till midnight. So, and I think it was about a 4-hour surgery, and usually it takes about 6. So he came out and said, "Look, the hookup." He said, "It went really quick. The hookup went great." He said, "But when I went to restart the heart, things just didn't go exactly like I wanted to," and so that was the first inclination that this wasn't something wasn't great. He was like, "I'm not sure." He said, "This happens sometimes, but we're going to see if we
Try
can
to make it work.
Try to make it work." So she's out of surgery and in ICU for probably 3 or 4 hours, and then she went into cardiac arrest in the ICU, and fortunately, the doctor was there on the floor
Again.
Yeah,
happened to
just
be
by
at the right
chance.
place
He had
at
just
the right time
been doing
again.
surgeries, so usually he's probably gone to go home, go to bed. Well, he just happened to come
Right.
back up to check on her. I mean, at that moment, she was coding, and so her chest was still open. They had to open her. And
Well, it had been titanium. It had been sutured. So they had to cut the sutures back open.
Yeah,
But the
they had-
titanium hadn't been wrapped.
Yeah,
So they still had to cut everything back
They
open.
had to go in, massage the heart for 20 minutes while they hooked her up on the
Is it ECMO?
ECMO machine. It's a short-term heart assist device where they put tubes into the chambers of the heart
two
to help
arteries and
pump
two
it.
veins.
So it's basically an artificial pump to help the heart.
When I woke up, I thought
they
I was
had
on
to do that in
dialysis.
there. Usually that's an operating room procedure, but they had
Didn't
no
have
choice.
time to do that.
She was checking out.
I
So
did not get infection.
yeah,
Still
and then,
to this day.
we get through that, and then he's like, "Look, we don't know, we don't know what kind of brain activity we're going to have here." So
Then
I'm hit with another. We don't know if she's going to pull through this.
Wow.
So 10 days they kept me pretty
Yeah,
much
comatose out, and then
in an ice bed with an ice vest, like ice water.
so the
flowing
first heart was
around
very
me.
traumatic. It just did not go very great, but she pulled through that.
And then how long did that first heart last then?
5.5 months. Off and on. It died a few more times.
See, on the ECMO is a short term, so they kept her on that.
Right.
Got her stabilized. We had to go back to surgery. They had to open her chest back up again, hook her up to what they call the VAD. It's a ventricular assisted device, which is a bigger long-term pump that they hook 4 tubes up. They go to the atrium and the ventricles. And so Kim has, laying in the bed, she has 4
Garden hoses.
garden hoses coming out of her, 4 drain hoses.
And then
I bet that was very interesting for your children. Did they ever see you like that?
Yeah, they did. And,
they got traumatized by the
I was about to say, how did they do with that?
Yeah.
Sometimes it depends on the
intubating
kids'
tube and all,
ages.
yeah.
And
yeah, it wasn't too good.
yeah.
I'm very close to my boys.
Yeah.
We're friends as well. I mean, and people, you can't be your friends. No, I'm still a parent. But
But you're
I'm-
able to talk to them.
I'm a
and they're-
tomboy, so I mean, we've all, I've never been left out unless I chose to be left out. They took me everywhere. I never got left at the dock. Well, I did after a while when I couldn't swim real good. My heart, when I got to where I got afraid of going with them because
But-
they were wide open.
But to kind of get back, so they got her
Yeah.
off the ECMO on the VADs, and the heart started getting better, a little bit better. He said, "Well, this thing might take," and so I forget how long that was. We were on that, then we go back into the operating room to disconnect everything and to close the chest.
And to take the breast implants out because they had popped.
Well, that was the second heart. You're getting ahead.
Nope, that was the first heart. That was the first heart. They popped those, and those had to come out. When they went in to take all that ECMO stuff, they had to take those out.
Probably, I can't
Yeah,
remember.
yeah.
Yeah, so
Yep.
maybe so. So anyway, so we get the chest closed, and the second heart seems to be doing okay. Not great, but
Yes. The
Well, no,
first heart transplant
Yes.
did great.
well,
No.
If-
How many months did you go on that one?
5.5.
5.5. So,
So-
at the 5.5 month point,
that-
I got another one.
yeah.
So
And I
did they
wasn't
put-
doing well.
Okay.
I was
Yeah.
doing terrible.
Yeah,
I
she was still in
to
the
go
hospital.
back.
Stayed
I
in the
never got to
hospital
come
the whole time.
home
Never
because I
came
kept
home.
dying, and it was only right.
you were in the hospital how long?
6 months.
6 months.
Lived
So you were
with
in the
it.
hospital.
Yeah.
And went in
At the hospital.
Yeah, it was the right-sided heart failure thing all over again. The
Okay.
left ventricle wasn't working with the other heart at startup.
But you were closely being monitored so they could
yes,
see what
yeah.
was going
They
on.
thought for a little bit she was getting a little, that heart was getting a little better, and
Yeah.
then finally it just started going down. They were like, this is not looking good. We're going to probably go back on the transplant list. So Kim had to make a decision if she was going to go through that. And at first I don't think she wasn't going to do it. And then
It was pretty traumatic
because
the coma was real hard for my brain to readjust after, because I had nightmares being under so long. My brain, every time I try to shut my eyes, I couldn't have my eyelids down before nightmares began. So I went 4 straight days without sleep. And so now, not only nightmares, now I'm sleep deprived, psychosis setting in.
Right.
But they were afraid to mix up any kind of cocktail. The brain had been insulted. And it's getting to the point where, well, we gotta decide something. This patient's not gonna keep going on like this. And man, it was seriously, those young residents, they got a good dose of teaching during those 6 months. I kept increasing in number of how many little white coats would wrap around my bed, because it got to where everybody just had an opinion about this.
Well, it's a very unusual case.
Yes.
It is very unusual case, and for you to survive all of that, it's even more unusual.
Yeah, no brain damage, no infection to speak of. Just pretty remarkable.
Yep. And so with the second heart, it didn't look like I was going to make it. I remember
Again, they're
it's
telling you that
Christmas.
again.
Yeah, this one's
They
failing,
didn't even have
failing.
to
Yeah.
tell me. I started calling him and going, my toes are black.
Yeah.
And
Circulation's getting poor.
Yeah.
And I said, I'm putting them up on the pillows, but they're not. It's swelling, and I'm starting to have this and that, and then it started creeping up, and
they're
yet
pumping her full of Mirinol, epinephrine. All kinds of IVs, just throwing everything they got at it to get all the.
But being O negative, I was also put through plasmapheresis, as partly because we have antibodies and alleles to this first heart. So even though it's O negative, they're still not a perfect match.
Correct.
So we're now flushing all this, trying
Somebody
to get me
else's
ready.
heart.
Right.
Yeah.
So we're
Right.
now trying to get me ready to not have anything to attack this heart. But you can't take my immune system. But so far, by this point, my immune system's just. But the prednisone now had taken such a toll. I was the blueberry Willy Wonka girl. I really, really was so swollen with fluid. I had slits for eyes and a tiny mouth and fluid. I just lost all my albumin. So I was emaciated, literally, completely emaciated, but swollen. So they told him, said, we don't know that she can survive.
So the second heart
surgery.
was when? When was the second heart?
January 2nd.
Afternoons,
So
yeah.
5.5 months, we get it. They make the decision, and it was because of the display of the will to live. He said from the first surgery, because I haven't seen a patient with the what do you say?
Yeah, because to get back on the top of the list is transplant.
That's
It's
difficult.
super,
Yeah.
super high risk. You're like, all right, is this even worth
Right.
the effort?
Is she
Right.
got what it
And so
takes
they had to
get
go to bat. They had to go to bat for her. The doctors did. They really
Yeah.
went to bat for her. They said,
Dr.
"This
Chatham
is-"
Patel wrote the letter of all letters.
Yeah. So put her back at the top of the list.
It was easy to do, though. You did have a will to live.
Yeah.
I fought so hard. Phew.
And then that one went fairly routine from what they understood.
If I could, yeah. The heart did, but the body was so decrepit.
course.
That was the hard
Well,
part.
you've been sick for so long, and you
in the
had to
bed
come
for so
back
long,
from that.
and
Lots of physical therapy and
you had to prove you could walk and swallow. And being intubated as many times as I've been intubated, I was having some swallowing issues. But the moment I found out, that was part of what was holding me back.
Well, that was part of the to get home. Well, the other miracle is, after the second heart.
Oh yeah,
we
Dr.
walked-
Malone was in Taiwan. Thank you. Yeah, and he was in Taiwan.
Milano, yeah.
Yeah, Dr. Milano.
But then he came back.
He got back January 1st.
Yeah.
He had to go jet lag into.
Because we were going to have to
the
take
OR.
whoever was going on call.
And I was
Right.
like
We
preferred
waiting for
Milan,
Right,
but-
because the heart's there. The heart can't wait for the
That's
right surgeon
and
to
they're
come.
on the schedule too. You know, he
Right.
can't work every day, all
Right.
day. So for him to get to do it again, and he's one of the top.
He is
top-
the one. He's the one that made the
top guys
LVAD
up there.
too. He patented the LVAD.
So January 2nd,
Got the heart.
Got the
new
heart.
heart. How much longer were you in, were you
Oh,
in the
no.
hospital then?
14 days.
Yeah.
Ooh, that's
Well,
Walked out.
He didn't walk. No. Well, I didn't really walk out.
Well, you
No,
got
I-
in the car.
you rolled out.
No, you listen.
she
I had to. You talking about fake it till you make it? They said, "Honey, you ain't getting out of here unless you can walk." I sat there. I was just letting. Okay, that's okay. Then they were like, "And you have to pass the swallow test, and we're going to put that camera, through your nose and down your." No, you're not. I'll pass that test for you today. Well, no. I'll pass that test for you today. Don't you worry about it. You handle your part. I'll handle my part. And I told him, I said, I'm coming home. He goes, it's only been 14 days. I can't handle you at home. I mean, no. I was like, don't you
Yeah.
worry about that. I'm coming home if I have to AMA, crawl out of here. But it gave me just enough oxygen that Spitfire part of me came back.
Came back.
And I wouldn't get back in the bed. From the time they got me out of my coma, of course, everything else didn't work. Nothing worked. It'd been in the bed so long.
Right.
That having to sit up in the chair, I was bound and determined. Oh, I was bound. I was going home. All I did was stare out that window. They brought me something. I just stared out that window. I took what they wanted. I stared out that window, pictured myself going home, telling the Lord, thank you very much. I know this was you. Started clicking it off. Every single thing that wasn't a coincidence, every single thing that wasn't happenstance, that he had been faithful to me. He had done what he said he would do. That faith without sight, I walked it out. That he is my God and I'm his people and I will be there and Jesus is my Messiah and I'm down that path. I just kept picturing it. I remember the clouds he showed me, and there wasn't nobody in that hospital that was going to tell me any different, including poor him. I made him come up and pack my stuff up.
I was like, there's no way we're going to get to go.
Did that scare you?
Yes.
Yeah,
Did
because-
that scare
yeah,
you
just-
having her at home after everything she'd been through?
Well,
and
I was worried about how, fragile, being through that much.
Right.
I thought it was too quick.
fragile's a very good word.
I thought it was too quick, but hindsight and of course from Dr. Milano, it's like the sooner we get her out of here, and get her home
Right.
she's going to do just as well at home as she's going to do here, or
Do better
even
at
better
home.
because the atmosphere you're with your kids.
Right.
You're back. You've
Back
been here for
to
6
normal
months.
routine.
Here, you got to get out of it. You got to get out of this
Right.
environment. So it ended up being the best thing. We had the home health physical therapy coming, and of course
Yeah.
Kim's a nurse, and this ain't her first rodeo. She's
So I like that
tough.
Spitfire word that you use because number one,
It's the
that's
Bearcat
probably
attitude, what we call our
Bearcat,
house. Yeah.
not Spitfire.
That's a tough animal.
Bearcat. Okay. So, what I'm sensing from this is you were very active all along,
Yes.
which probably worked in your favor.
Yeah.
And your attitude,
Yeah.
your spiritual
It's always
beliefs.
filling up.
Yeah.
And your support. I mean,
Yeah.
obviously, you were in the hospital. You had the home fires burning.
Yes.
And trying to work. So I'm guessing that you had assistance from friends,
Oh,
church
yes.
folks,
Oldest
Yes.
child.
Yes.
colleagues.
Yep, our oldest
Yeah.
boy helps a lot. He was, fortunate he could drive, and yes, I
everybody
did.
to school.
Yeah, my my
Picked
dental
him up from
colleagues
school.
helped cover me if I had to be gone. Church, family support.
Our
us tremendously with
neighbors were
food,
incredible.
Neighbors, just people came out of the
Jody
woodwork.
Rooney was
In fact, we had so many
incredible.
people trying to help us. We had to call it off. We had so
Right.
much food coming to the house. I was
Too
like,
many
White House
pasta
worship
dishes.
I was like,
center.
or-
Oh my
thank you, but
gosh.
I can't.
Prayer
I don't know what to do with
chains.
this, and so we
Yeah.
had to back it
And
off. But it
Lighthouse
was,
took care of us when we got home, too.
Yeah.
So it was tremendous. It was tremendous support. Yeah.
But he could not. When he got there and he was looking at me going, she can't stand up. And I said, shh. Shh.
Yes, I
Who
can.
throw me under the bus? I've already been thrown under the OR table. Don't throw me under the
There's
bus.
the Bearcat.
Oh, but he knew at this point, it was like, she will. I would have snuck out of there.
Yeah.
If I could have, I was beginning to think of enlisting the cafeteria people, visitors. I had to go home. I had it. And I think they had it with me.
And tell me what year that was.
That was 18 months ago.
18 months ago. So what is life for you like now? I know a little bit of this as you told me what you do during the day, but if you can tell our audience what you do now during the day with your boys, where you live.
Oh, wow. Well, last summer wasn't as easy because this time last summer,
Oh, gosh.
then I was only
How many months out of the hospital?
6 months out?
nine-
No, how many months out were you?
4 months out? Let's see.
Broke
Wait,
her
I was
hip.
January. Oh,
What?
I fell and broke my hip shortly after I got home.
I mean-
as soon as I started walking, I thought I was walking good. When you have been in the bed that long and you can start finally abandoning the walker and you go, oh, look, I made
Yeah.
it over here at the refrigerator. Well, let me see if I can make it over there to the microwave. Mm-hmm. Oh, well, look at there. I made it all. Okay. Well, you know, I think the best way to answer that question is this. Dr. Barber who's my local cardiologist, he turns the monitor of his computer around when I go to visit him and says, do you want to see what your physical therapist wrote about you? And I went, oh, I thought she liked me. And he started laughing. And he started reading off all this stuff. She works harder, does more things than we are practicing, and is a high risk for fall.
Oh.
But the thing is I didn't fall in my house, and that was, that was outside.
Yeah. So we had moved out to the country, and we had horses
baby horse
and
born
chickens
while I was gone.
and a cow. So we had
Okay.
animals to tend to. So she wanted to get out there and be with her animals, and
I wanna see-
unfortunately,
Alright.
the ground gave way, and
It was sand.
The
yeah.
ground gave way.
well, it was a divot. She
Well,
fell.
no,
That's her story, and she's sticking by
I
it.
was balanced. I was balanced and was getting ready to navigate out of the sand, and that's when the little baby horse walked up. So I just froze and introduced myself, and then it being a young little filly, flipped around and threw its little body up in the air, and I startled. And all those nice little marching exercises, do your marching exercises. It's not for marching, it's for picking your legs up higher. I couldn't clear the embankment of the sand pit I was standing
The
in.
embankment.
That's where I went down and thought I had just dislocated because I've been thrown off of horses.
So
and
that was a year ago.
a year
was-
ago March.
A year
Yeah. So
ago.
that was 3 months after being out of the hospital.
But I got
Broken hip.
got pins. Yeah, and they were all going to send me back to Duke again. And
Yeah.
I was very convincing. And praise God, Cape Fear Hospital, they are truly the best for knees and hips. I hated to see that, they're moving their outfit from there to the main hospital. But, since I wasn't going to be intubated and they were going to do a spinal block, I was able to convince everybody that this would work better here than there, since these guys were good for knees and hips, and Duke
they were
was
not going
good
to
for
take no
hearts.
for an answer.
I had to get
That was no way.
and it was very nice.
I think she's a Spitfire Bearcat. That's what it is.
And Dr. Lippy put them in, and
So we're
Dr.
just-
Bowen took them out, and
So
I
we're
am
like,
doing
God. So
good.
finally, once you get, gets healed up of the hip.
Well, I was riding the horse with the pin in.
Yeah.
But I'm riding a bit better without the pins.
So every day now, you're taking care of animals,
Yep.
and you're taking care of your 2 boys that are still at home, right? The older boy is
They still have 3 boys.
3 boys at home.
Yep.
Yeah,
And-
everybody is. Yeah.
Yep.
They are probably going to stay home since it scared them so bad that every time the oldest is about ready to launch, it's okay with me. I'm fine with everybody being home. So, I mean, everybody learned a lot of self-sufficiency. Mm-hmm. So, and us being older parents, it is really neat that the children, they have some for us to be able to even be here tonight,
Yeah.
they're handling everything. Everybody has a buddy system and situation. So,
They had to grow up a little faster, but in a good way, I think.
yeah. And they appreciate each other,
So-
even though they still act like brothers.
Yeah.
They do appreciate each other, and
So Kim's rolling pretty good with life.
Well, I
a
like
few hiccups
that.
here and there, but
I like that. I think the true challenge is we're still using some of those drugs for breast cancer treatment. And we still don't know why some people have to go through what you did, and then some people get cured from those same drugs and may not have any cardiac toxicities. So we just don't know enough now. I did a quick internet search and looked at cardiac toxicities, and you wouldn't believe the amount of research that comes up. And now they have specific departments associated with that. So we're really looking at the problem there, which makes me happy. And when you were diagnosed in 1993, they did not have something called Oncotype DX, which is a type of test that they'll kind of do. They look at what the potential for metastasis is, and it'll come out as low risk, medium, or high risk, and tell folks whether or not they should consider chemotherapy.
Of any sort? Wow.
So
interesting.
So they continue to make improvements. The sad part is, like I said, we don't know who might have some of those toxicities, whether it's cardiac or something else. And we still are learning about
When I
breast
first got
cancer.
diagnosed, it was almost unheard of, really. I mean, you heard a little bit about it, but to the point they didn't do mammograms until after you turned 50.
Right.
In the late 80s, early 90s. And since my mom had the breast cancer and being very advocate and started Bosom Buddies, she had my sister and I learning the breast self-exam as teenagers and said we should have our first breast exam mammogram by the time we're 30 years old, which now it's even earlier than that. And when I went at 30, I was in Maryland. And they told me no, I wasn't old enough. And I said, my mama told me. And here's my money to pay for it out of pocket because she said you'd say that.
Wow.
So she said to tell you I am here for a baseline. And so I had a baseline. I had that mammogram done April. I found my lump myself in October.
Yeah.
And it was because it was cut off on the frame. Now that was back to the smashing ones. And you know, being a double mastectomy, I haven't had any mammograms in years, so I don't know the technology that's increased or not. But
And
I think
they've
gone
to digital
And
mammography, which
gravity,
is
right?
Which is
Are they still
it's
doing
a
the
better it's a better picture now. And now they'll do mammography followed by ultrasound followed by MRI if you're high risk. So we are getting better. We're just not quite there yet.
Even the second breast lump I had was cut off by the frame. And they had a high resolution and all that, but it was still in the frame. That's why I was pretty excited when they started doing the table, where the women could lay on the table and everything. But
Right.
mine was still
And the
right on.
MRI has helped us another diagnostic tool for that too.
And I think telling patients to be they're going to have to be their own advocate, even though there's a lot of advocacy places. And I think, I hate to say it, but being a nurse and working in it and being there as myself, whenever you become the woman who gets diagnosed, you become the deer in headlights all of a sudden until you regroup. But during your deer in the headlight moments, you've got to have somebody else advocate for you until you can start advocating. But I think women need permission to advocate for themselves, and that doesn't mean they're being mouthy, abruptive, disagreeable, rebellious, rude, or anything else if they're advocating for themselves.
Right.
I think doctors are more open to it now, but there may be other people who may say, no, you need to do what the doctor says. And it could be some of the older population that goes, no, the doctor knows best. Now you just quit asking so many. Don't waste their time. They're very busy. No, you go in with your piece of paper, have your questions, ask those things, research. Google is so big now. Here's one of the things, and he will attest to this, one of the things that I said, like with Coreg, Dr. Barber could only inform me as to what my heart may go through when I would start to wean and go off of Coreg. He gave me informed consent. My sentence was this: I will live and die with my decision. I will live or die with my decision. And it was the same thing with my second round of chemotherapy. I didn't do 6. I walked out of there at 4 and said, won't be back. Thank you. Have a good day. And I love you very much, but I'm not coming back for the next 2. And I never went back.
Yeah.
But I prayed about that. I made a decision that I could live or die with, that I would back up my decision. But I had looked into it well enough. I had been down these different paths. I had to look at the quality of this and the quality of that and make a decision.
Right.
So, and that was the same thing with making the second heart. Could I do this? And if I said I would do that again, because it had been so traumatic with that first heart, if I said I would do that again, was I going to put all of me back into backing it up, that if I said I would do it,
Right.
that I would step up in there and do it too? And I
Right.
think that's another thing, is you advocate for yourself, but every patient is more a part of the solution than the doctors, the nurses, the medicine, and treatment.
It has to be teamwork.
Exactly, and they are part of that round table. And for a long time, I never let anybody call me a patient, because I always looked at myself as part of the team. You know, for whatever reason at Duke, I decided I was tired. I would be a patient.
Well, I think it's
For a little
okay
while.
if you were in for that long. Well, I want to thank you both so much for being here and sharing your story. It's an incredible story of survival. I think that you mentioned the spiritual part that kept you through, your attitude, the teamwork, not only of the medical team, but really the community. Sometimes I call that the circle of love. How did that circle of love help you get through? So thank you very much for being here.
Yes, ma'am.
And I wanted to tell you that July 11th is our next live webcast. We're going to switch gears a little bit, and we're going to start talking about wellness issues. We're going to talk about how to get healthier as you go through cancer treatment, or if you're a survivor. Our featured speaker will be Lori Manship, and she runs a program at the YWCA here in Wilmington, North Carolina. So join us on July 11th. And again, if you're not watching this live, it will be aired again on July 4th. Happy 4th of July. Thank you very much.